Hello, lovely. Thank you for coming in today. I've reviewed your yearly bloods and it's flagged a few irregularities, so I wanted to get you in for a checkup, alright? It's nothing to worry about, it's just formality, and if there is anything going on, it means we can get it sorted. Alright, you're very welcome. So, how are you? Good. Alright, I'm going to do some checks and I'll ask you some questions as we go. Alright, my lovely, you're welcome. So, I'm just going to start by taking your temperature. Just pop it in your ear. On the other side. Okay, that's fine. Let's just check your pulse and your oxygen levels. Can I just have your index finger? Thank you very much. So just relax. So, okay. Oxygen level is fantastic. Okay, I'm going to check your pulse manually, alright? Let's just... Okay, if I could have your wrist. Thank you. Okay. Right. Okay. Right, if I can have a listen to your chest, my love. Okay. Just breathe normally. nice deep breath in. Out. In. Out. In. Out. In. Out. Okay, I'm going to have a listen around the back. Take a nice deep breath in. Out. In. Out. In. Out. In. Out. Okay, I'm just gonna listen to your chest, and if I can have your wrist as well. Okay. I'm now going to pop this on your wrist, okay? Okay, thank you. Let's pop that over there. Okay. Have you noticed anything unusual at all? Any heart palpitations? Okay. And when? And that's not normal for you. When did that start? Okay. Right. Now, any extreme tiredness, fatigue, lethargic, anything like that? Okay, so you feel fatigue, but you're also having trouble sleeping, okay? Alright. A bit of low mood and energy, okay. Any changes in your mental health? Alright, so you've been experiencing anxiety. Okay. When's the last time you had anxiety? Yeah, so it's quite controlled with your medication, but it's creeping back in a little bit. Okay. Right. Okay, let's got some other questions to ask you, but I'll ask it in a little while, okay? Right. Okay. Right. Okay. I'm gonna have just a look in your eyes, okay? If you just look straight ahead for me. When did you last get your eyes tested? Okay. Maybe, just keep an eye on that. Okay. Okay, I want to follow my light. Okay. Okay, so eyes clear, pupils not good. Now, you can just look at my finger and can you just follow it with your eyes? Okay. That's all fine. Okay. I'm gonna have a look in your ears now. Okay. There we go. Have you noticed anything strange with your hearing at all? Okay. That looks fine. I'm going to go a little bit deeper. Yeah, that looks nice and clear. No redness, no swelling. Nothing abnormal there. And a healthy amount of wax too. Alright. On the other side. Okay, and in we go. Looks nice and clean. I'm just going to go a bit deeper. It looks good. No redness, no swelling. Normal amount of wax. Looks nice and healthy. That's good. Okay. to use all clean and healthy. Okay, right. Now I'm going to pop on some gloves, okay? Just want to carry out a few checks. While I'm popping my gloves on, would you mind just popping on the scales, please? Thank you. Okay, come and sit down. So, how's your weight? Is it okay for you? Have you put weight on? Have you lost weight, or is it about the same? Okay. And since when? Okay. Right. Can I have your hands? Okay, I'll start this one first. Just having a look at the skin. And your nails. Have you found that your nails are a bit brittle? Yeah, and I do feel a bit weak. Hands are a bit dry. You notice that? Yeah. Okay, let's look at the other one. Yeah, very similar dryness. Let's have a look at your nails. Okay. Okay. Okay, so right, your feet. Would you say they are similar to your hands? Are they looking quite dry and tired more than normal? And what about your toenails? Are they quite weak? Are they breaking off too? Okay. Okay. Now on your feet, is that kind of normal, or is that like more of a new thing? Yeah, okay. Yeah. Alright. Have you been experiencing any pain anywhere? Any headaches? Okay, any dizziness, blurred vision? Okay. What about body aches, pains, muscle joint pains, anything like that? Yeah. And when about? Yeah, okay. So that's more than usual. Okay, that's fine. And let me just put your weight down. Okay, how tall are you again? Okay. Is fine. Right, what about your skin all over your body? How is it? Is it been on the dry side? Has it been sore, sensitive, anything like that? Okay, let me just have a look at your face, my love. Now, what's your skin like on your face normally? Okay, so is this how your skin is day to day and has been for a long time, or? Okay, so you'll find it's looking a bit more dry, a bit cracked in places. Am I right to just have a feel around? Okay. Okay. Yeah, your skin does feel a little bit on the dry side. Let me just squeeze. It's definitely a little bit dehydrated as well. Do you use any skincare at all? Okay. Yeah. Alright, so you're using quite rich products, it's really thirsty, and yeah, it does feel a bit dry. There's no, obvious dry patches, but it does look quite dry, quite tight, dehydrated. So, okay. While I'm touching your face, I'm just going to feel under your eyes if that's okay. Under your eyes are looking a little bit puffy, my love. Is that normal for you? Okay, so, right, yeah, because you're not sleeping and the puffiness. Do you always have like your dark circles, or is that another new thing? Okay, so they're always there, and yeah, when like asleep, they get worse. Yeah, that's common. All right, but they are a little bit swollen, like puffiness. Yeah, try to just like gently tap it in, especially when you're putting on your product. Okay. Am I alright just to feel your sinuses now and just press different parts of your face? Okay. Okay. I'm going to bring it down now, okay? Okay, I'm just going to feel the glands. Does that feel okay? Bring it down now. Can you swallow? And again. Okay. Can you swallow? And can you swallow again? Okay. Open your mouth. And close. Can you just chew for me? Okay, relax. Okay. Okay, we'll go back to that in a moment. Okay, if I can have a look in your mouth now. Okay, open wide. Okay, say ah. Okay, pop your tongue out. Okay, pop it back in. Have you been getting any ulcers? Anything like that? Okay. I'm now going to pop this in your mouth. You can open. Say ah. Okay, you can relax. It's okay, your throat. Okay, there we go. Okay. You up to date with your dentist, my love? Okay. Teeth do look nice. That's why I asked. Right, okay. So, I'm going to get my reflex hammer. Okay. If you could just flop your arm for me, I'm going to do your elbow. Okay, and this one. Okay, and your knee. And the other one. Okay. Okay. I want you to touch your nose and then my finger. Nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, finger. Okay, now I want you to pop your finger out in front of you and I want you to touch your nose and then touch your finger. Okay, nose, finger, nose, finger, and swap. And nose, finger, nose, finger, nose, finger. Great. Now if you can put your arms out like that for me so I can just check your hands. Have you noticed any shaking, trembling, anything like that at all? Okay, you can relax. Okay. I'm going to have a look at your hair and scalp in a moment. Okay, so I'm going to get my comb in a moment as well. So just feeling for any lumps and bumps. Have you noticed your hair falling out or snapping off easily, and a bit more brittle than usual? And do you dye your hair? Okay. How often do you go to the hairdressers, my love? Okay. Okay, I'm just going to brush up. Okay. Right. So, any changes to your body temperature at all? Are you finding that you're extra hot or extra cold and you can't balance your temperature out? Okay, so you put it down to the summer. Okay, because it has been quite warm, quite humid. Okay. So have you noticed that's only really been throughout the summer? Obviously we are into early autumn now. How has things been? I know it's still been a little bit mild and a bit humid, but are you still having the same troubles? Okay. Okay. Yeah. All right, my lovely. Okay. So would you say you're a bit more sensitive to it then? Yeah. Okay. Right, any changes in your diet, your exercise, fluid intake, anything like that? And have you noticed anything? Okay. 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 Right, so you've been feeling anxious. Okay. Since when, my love? Okay. Yeah. So you've had low mood, which we mentioned, I think, and anxiety. Okay. And that's, you get a lot of that palpitations with the anxiety. Okay. So, would you say you've been feeling depressed or sad, or is it more of just like a low mood, miserable, and have you been having some mood swings or? Yeah. Okay. Now, with the anxiety, is there anything that's triggered that, or did you find it just comes and goes? Okay. And what about your digestion? How is that getting on? Are you okay? Yeah. So would you say that's a little different to normal, or is it about the same? Okay. What about your bladder? Are you finding that you need to go to the toilet more, less, or? Okay. And since when? Okay. Yeah. Okay, that's fine. Right. So, I'm gonna do your blood pressure, my love. Okay, if you can just put your arm on there for me. Okay, let's put that in there. Okay, just relax. It does go tight. Lovely. Okay, that's fine. Have you noticed any changes in your voice at all? Okay. Right, so I think I know what's going on with you, and you will need to see a specialist, my lovely. So going on your blood results and the exam I've done today, I would say that you are experiencing an underactive thyroid, okay? However, some of your symptoms are crossing into the overactive thyroid, so it's a little bit complicated. So I think you need to go and see an endocrinologist, and they will carry out all the necessary checks and things like that, sort out treatment plans, etc. Okay, that's the best people to see. Alright, and obviously here with your thyroid glands are swollen, so that's could be why you've been experiencing a little bit of pain as well. Alright, okay, so I'm going to refer you on. Yeah, that's why you've been feeling the way you have, my love. And you know, it wasn't just getting older, it wasn't just the weather and things. It's a lot of things have been going on and changes, so you're all over the shop at the moment. But yeah, and because you do have other symptoms which overlap into the overactive, I'm a little bit concerned about what's going on there. And because I'm not a specialist in that area, I can't really, you know, help out with that. Yeah, and that's why I called you in, because the blood levels did indicate that. And there's a couple of deficiencies as well, my lovely. You've got a vitamin D and folic acid deficiency as well. Okay, so you will need to start treatment on that. But I definitely want you to see the endocrinologist as well, ASAP. I can refer you on if you would like. Okay, waiting list. It's quite a while, my lovely, but we'll do our best to get it in ASAP, because it is, you know, needs to be sorted, you know, sooner rather than later. Okay, you would like to do that? I could definitely do your private referral, my love. Okay, private referral. I'll do you a letter and I will email it over. Let me just check if I got the right email. So if you can just give me that for me. Thank you. Okay, fine, that's fine. I will email that. So I do the letter. I won't do it myself. I need to get the secretary to do it. So they will do the letter for you, okay? And then they will email it to you, and then you can print it off and take it to your specialist. I mean, when you go in private, I mean, if you ring tomorrow, you should be able to get it in the next few days. So that'd be good. So I won't start you on any treatment, because I need you to see these, get some tests done, and then they'll put you on the right treatment. Yeah, I mean, if you were going on the NHS, I would obviously have to wait a little bit. There's a wait time, so I would put you on treatment for an underactive thyroid. But yeah, I think it's best that you go ASAP, discuss your symptoms, you know, have a full check, do some other bloods and whatever other things that they do, and then they can come out with a treatment plan. All right, my lovely, you are very, very welcome. So, is there anything else you need to tell me? Anything, how you're feeling and that? Because it's really good, I can add it on the referral. Mm-hmm. Mm-hmm. Okay, let me just have a feel. Okay. Let me just put my hands on your shoulders. Now your arm. Okay. Is it sensitive to touch? Okay, we got this one. Okay. Just get your arm up and down, and out, and down, down, up, down, out, down. You've definitely got some restriction around your shoulders. Let me just feel it up the spine, and your neck there. Yeah, there's definitely a lot of tension around the shoulder blades and the neck. Okay. Yeah, I mean, you can get pain and things like that, but not so much, you know. That's normally we're looking at other kind of issues. Yeah. I mean, with the chronic pain and the pains and things as well, I mean, there could be issues like fibromyalgia and things, but again, I'm not an expert in that. So I think what the best bet is to do is see the specialist, tell them about all your pains and the joints and all these issues, and then if they think, well, no, there's probably something else going on as well, they can then refer you to the right people, and then you can get a referral from them, and then they can do it. So for example, if they think, I think it might be a good idea that you see a neurologist or a rheumatologist or something like that, they can do the referral there and then for you, and then you can go and see a specialist. Yeah. Okay, I'll make sure I pop on the notes that to check and, you know, the pain and things. I mean, they, like I said, they cover everything, so, you know, anything to do with the endocrine system, so they'll be able to check all sorts of different bloods. Yeah, so you'll be having a lot of blood taken. Alright, well, it's lovely to see you, and, you know, I'm sorry you've been feeling unwell, but we're on the right track now, and hopefully we can get you sorted and start feeling a bit more human again. Yeah. Alright, my lovely, you should have came to me. I know, I understand. Anyway, at least we've got a little bit more insight now, and you might be feeling a little bit weight lifted off you. They can also help with obviously other medications and things, or they can come back to me, and if you need to tweak some of your mental health meds, I can do something like that for you. But I don't want to mess with anything yet until you've seen those. Alright, so I would say stay away from any supplements at the moment as well. I will send obviously over all the bloods that I took and all the information, so you can get, you know, the best treatment available. Alright, my lovely. It was an absolute pleasure to meet you, and I'm so sorry that you're feeling unwell, but I wish you well. Alright. Yeah. Okay, well, I will get the report back anyway, and if I feel like I would like to see you or have a chat with you over the phone, I will contact you. Alright, but all the best with everything, my lovely. Alright. You're very welcome. You take care now. Bye-bye.